1, 2, 3, 4, 5, 6, 7.
Okay.
Ready?
Yes, sir.
All right. Thank you. Tonight, after consultation with medical experts, the DFW Hospital Council, and the persons who prepared the North Texas Mass Critical Care Plan for both pediatrics and adults, I announce to you a difficult decision, but one based on science. Dallas County will move to a safer at home order. This is also known as a shelter-in-place order. This order is our best chance to flatten the curve here in Dallas County and save as many lives as possible. I know there will be economic hardship and business closures with this order, and it makes me sick that we are at this point. My hope is that President Trump, I had members of both the Republican Party and the Democratic Party in Congress call me last night and pledged to me that they were working hard on a stimulus package that would be, hopefully in their minds, the first of many. And I reiterated to all who called me the importance that our people need money while they are at home and to buy life's necessities. That our people cannot have disruptions in their services while they are at home, and that our people cannot lose their homes. And that of equal importance, when we come out of this on the other side, and we will come out of this on the other side, that jobs and businesses, particularly small businesses, that will be most affected and their employees by this situation and the need for these orders will come out with their livelihoods intact. I want to show you, I want to say a couple of words about it, and then I'm going to turn it over to Phil to explain it more, because before we talk about the shelter-in-place order, I want you to understand why that is. Do I need to take this? All right, and I'll give it to Phil when I'm done. This is a graph. You can get this online. We'll make sure that stations make this available. It's from COVID Act Now. This is the graph for the state of Texas. All right, this black line is our available hospital beds. See that? Thank God that the governor has acted now so that our state won't see this. Our state, now that this is a statewide ban, and I was so in hopes that this would be statewide and that I would not be standing here tonight, and we still need it to be regional and statewide. This is shelter in place. This is where we are now. This is how many hospital beds we have. This is May 23rd. This is the number of people, if we stay with social distancing, that will need to be in the hospital while we have this many beds. This is why we are calling on the North Texas business community to create ventilators, to retool every manufacturing facility that can, and make ventilators and PPEs and other vital equipment. There's not much good news or easy choices in this. Blue is shelter in place. This is not my idea of what it looks like. This is what the medical scientists, and science at this point on a novel virus is a best guess, but it's a best guess based on the science, the data, and what they're seeing in the other countries that are farther ahead of us on this terrible outbreak. This, folks, is safer at home. God willing, this and the mass production of ventilators will keep us from the specter of rationing care. And so, Phil, do you want to add some things to that, and then I'll explain the order?
Sure. I can
Different mic? Oh,
okay, sure.
yeah.
Sure. As the judge said, these models are based on some of the Imperial College study modeling that has been out there. It shows like the critical point, April 13th, I believe, or April 12th, if the no action of when we would hit that overload for the hospitals. With the current setting of our social distancing, the critical point is marked at April 28th, when we would exceed the number of hospital beds in Dallas County. But as you can see, both with this other bottom one is 3 months of the actual Wuhan style level of total lockdown. But this is shelter in place, which is very similar to the demand on hospital beds. On that other chart, you can see estimated deaths. This is for Texas-wide, not specific to Dallas County, but estimated 583,000 deaths if there were no actions. With the current social distancing, about 430,000 deaths in Texas. However, then with the shelter in place, about 5,000 deaths in Texas. So dramatic reductions that would be seen that are according to these modeling estimates with this implementation.
As I've said, the goal of this order is never to exceed our hospital capacity and to minimize the catastrophic outcomes we are seeing in other countries because they waited too long. We have seen deaths in Dallas County. We announced one this morning. It's sad news to inform you that another person has died in the last few hours. The simple truth is that the numbers tell me that we must act swiftly. We are headed to a point of no return if we continue to dawdle. And while I know what we must do, the powers at my disposal can't do it without all of you. And for that matter, we can't do it without at least our regional partners. I'm hopeful that in doing this action, and I spoke to the Harris County judge, and they're committed to doing the same. Lynn Hidalgo is an amazing leader there, and they're facing community spread as well. I believe that that will happen soon, and I'm hopeful that the governor will reconsider. I was very hopeful that this would be statewide. Didn't know what the answer would be. The DFW Hospital Council and many of us had implored him before the conference today, and I appreciate the difficult situation that he is in, but I really believe it is imperative that this is larger than Dallas County. So I would implore him to reconsider. For instance, in Dallas County, we saw a doubling of the cases today, and we're going to continue to see that rapid growth like everyone else who has community spread and COVID on this earth has experienced, and so we cannot afford to wait. I was heartened by Tarrant County yesterday moving to mirror Dallas's previous orders and the orders that we passed yesterday. I'm very hopeful, and I know that the same doctors who are talking to me are the same doctors that are talking to the county judges in the 4 largest counties, and I would assume perhaps some of the smaller ones. So I'm very hopeful that this will quickly be adopted across the Metroplex because, as you can see, if it's not, we won't be in the blue. We'll be somewhere in between where we could be in the blue if we acted together and where the orange is. But together, we can do this. Now, everybody has a role to play. I've talked about what I'm imploring our government leaders who have the power to protect you to do, but you have a huge role too. I'm going to go through this order. I'm going to spend as much time with you as it takes to go through it and answer all these people's questions, because I recognize when I'm answering their questions, I'm answering your questions. But after it's explained to you, There are going to be aspects of it you're not going to like. There's aspects of it that I don't like. But we have got to do this, and we've got to do it together, and we got to help each other do it, guys. So with that said, let me begin to go. I'm going to give you first the summary of the changes, and then we'll go through and read through the entire order. The order requires individuals currently living in Dallas County are to shelter at their place of residence unless performing an essential activity like going to the grocery store or receiving essential medical care, outdoor exercise, and other things that I will go through with you and answer your questions about. All businesses operating within Dallas County, except for essential businesses, are required to cease in-person operations effective midnight tomorrow. Essential businesses include essential healthcare operations, which we will more fully define, essential government functions, essential critical infrastructure, essential retail, providers of basic necessities to economically disadvantaged populations, essential services necessary to maintain essential operations of residences or other essential businesses, the news media, child care services for employees with essential service duties, all public or private gatherings of any number of people occurring outside a single household or living unit are prohibited. Religious and worship services may only be provided by video and teleconference. And with that, I will skip the whereases and get to the meat of this and spend time with you explaining this order. Effective as of 11:59 p.m. on March 23, 2020, and continuing until 11:59 p.m. on April 3, 2020, and the reason for that date is April 3, 2020 is when my current authority expires. I fully expect that authority will be extended. It always has been, I believe it will be, for as long as it takes us to get through this crisis. All individuals currently living within Dallas County are ordered to shelter at their place of residence. For the purposes of this order, residence includes hotels, motels, shared rental, and similar facilities. To the extent individuals are using shared or outdoor spaces, they must at all times, as reasonably as possible, maintain social distance of at least 6 feet from any other person when they are outside their residence. This means if you're planning on walking on a trail and it's crowded and you can't stay 6 feet from the people around you, don't walk on the trail. All persons may leave their residence only for essential activities, or to provide or perform essential government functions, or to operate essential businesses as defined in Section 2. All businesses operating within Dallas County except essential businesses as defined in below Section 2 are required to cease all activities at facilities located within the county. For clarity, businesses may continue operating, consisting exclusively of employees or contractors, performing activities at their own residence, working from home. To the greatest extent possible, all essential businesses shall comply with the social distancing guidelines attached, including maintaining 6-foot social distancing for both employees and the general public. All public and private gatherings of any number of people occurring outside a single household or living unit are prohibited, except as provided herein. Nothing in this order prohibits the gathering of members of a household or living unit. Restaurants, with or without drive-ins, or drive-through services and microbreweries, microdistilleries, or wineries may only provide takeout, delivery, or drive-through services as allowed by law. Religious and worship services may only be provided by video and teleconference. Religious institutions must limit in-person staff to 10 persons or less when preparing for or conducting video or teleconference services, and all individuals must follow the social distancing guidelines, including the 6-foot social distancing. All elective, medical, surgical, and dental procedures are prohibited anywhere in Dallas County. Hospitals, ambulatory surgery centers, dental offices, and other medical offices are directed to identify procedures that are deemed elective by assessing which procedures can be postponed or canceled based on patient risk. Considering the emergency need for redirection of resources to the COVID-19 response. For purposes of this order, individuals may leave their residence only to perform any of the following essential activities: to engage in activities or perform tasks essential to the health and safety or to the health and safety of their family or household members. For example, obtaining medical supplies or medication, visiting a healthcare professional, or obtaining supplies that you need to go from work. And that also includes if you have older parents, and those parents need your help, need you to take them food, you may do that, of course, if they're in a different residence. To obtain necessary services for supplies for themselves and their family or household members, or to deliver those services or supplies to others, for example, food, pet supplies, and any other household consumer product, and products necessary to maintain the safety, sanitation, and essential operations of residences. To engage in outdoor activity, provided the individuals comply with social distancing. Requirements of 6 feet, for example, walking, biking, hiking, and running. Let me stop here for a second. I want us to be gracious and compassionate to one another. I want you to think about the sacrifice of the greatest generation and the level of selfishness and determination to protecting one another that they had. And I want you to make that your guidepost. So I want you to be gracious to one another, but when you see people that are way too close together, when you see people out in public that aren't following this, nicely remind them by saying 6 feet. Okay? To perform work, providing essential products and services at an essential business, or to otherwise carry out activities specifically permitted in this order, to care for a family member or a pet in another household. For purposes of this order, essential business means healthcare operations, including hospitals, clinics, dentists, pharmacies, pharmaceuticals, and biotechnology companies or other healthcare facilities, healthcare supplies, mental health providers, substance abuse service providers, blood banks, medical research, laboratory services, and any related or ancillary healthcare service. Home-based and residential care for seniors, adults, and children are considered healthcare operations. Healthcare operations also include veterinary care and all health and welfare services provided to animals. This exemption shall be viewed broadly to avoid any impacts to the delivery of healthcare. Healthcare operations do not include fitness and exercise gyms and similar facilities. Healthcare operations do not include elective medical, surgical, and dental procedures as established in accordance with subsection G of this order. Essential government functions. All services provided by local government needed to ensure, local, state, or federal government here in Dallas County needed to ensure the continuing operation of the government agencies to provide for the health, safety, and welfare of the public. Further, nothing in this order shall prohibit any individual from performing or accessing essential government functions. All essential government functions shall be performed in compliance with social distancing requirement of 6 feet to the extent possible. Essential critical infrastructure. Work necessary to the operation and maintenance of the 16 critical infrastructure sectors as identified by the National Cybersecurity and Infrastructure Agency, including public works construction, residential and commercial construction, airport operations, water, sewer, gas, electrical, oil refining, roads and highways, public transportation, solid waste collection and removal, internet and telecommunication systems, including the provision of essential global, national, and local infrastructure for computing services, business infrastructure, communications, and web-based services, financial institutions, defense, and national security-related operations. Essential manufacturing operations provided that they carry out those services or that work in compliance with social distancing requirements of 6 feet to the extent possible. Essential businesses providing essential infrastructure should implement screening precautions to protect employees, and all activities shall be performed in compliance with social distancing guidelines attached. I will be passing further orders to the extent possible to relax any regulation that would stop any employee from serving as the temperature taker as people come into these essential services, because we would like people to first take your temperature at home if you're coming into an essential service, and second, we need our businesses to set up forehead thermometers as people come in. If folks are sick, they just can't work that day. If you have a temperature as defined by anything above 99.6, you cannot work that day. You can be more restrictive than that, but we're not going to be less restrictive. If you want to make it 98.5, that's fine with me. For service providers, including grocery stores, warehouse stores, big box stores, bodegas, liquor stores, gas stations, convenience stores, farmers markets that sell food products and household staples, food cultivation, including farming, fishing, and livestock, businesses that ship or deliver groceries, food, goods, or services directly to residents, restaurants and other facilities that prepare and serve food, but only for delivery and carryout, schools and other entities that typically provide free lunch to students or members of the public on a pickup and takeaway basis only. The restriction of delivery or carryout does not apply to cafes and restaurants located within hospitals and medical facilities, laundromats, dry cleaners, and laundry service providers, gas stations, auto supply, auto and bicycle repair, hardware stores, and related facilities, businesses that supply products needed for people to work from home. Next, providers of basic necessities to economically disadvantaged populations, businesses that provide food, shelter, and social services, and other necessities of life for economically disadvantaged people or otherwise needy individuals and families. Essential services necessary to maintain essential operations of residences or other essential businesses, such as trash and recycling collection, processing and disposal, mail and shipping services, building, cleaning and maintenance, warehouse and distribution and fulfillment, storage for essential businesses. So if it's an essential business that is open, then the janitors can continue to work there. If it's for an essential business, then the logistics warehouse can continue to be open. We have to have warehouses to have the groceries in the stores. Let me stop and say something about that real fast. I know this order is going to worry people, and as I talk to the supply chain of the grocery stores today, they expect that people will hear this and somehow think grocery stores are closing. And even though I'm telling you they're not, and they aren't, and they're not going to, guys. We have to eat. We have to have food. So your grocery store will remain open, whether you shop today, shop tomorrow, or shop after the safer at home order. The grocery stores will remain open. The supply chain is working fine if we'll stop hoarding items. All right. So continuing on with what are essential services, funeral homes, crematoriums, and cemeteries, plumbers, electricians, exterminators, and other service providers who provide services that are necessary to maintaining the safety, sanitation, and essential operations of residences and essential businesses. Professional services such as legal or accounting services when necessary to assist in the compliance with legally mandated activities. Businesses that supply other essential businesses with the support of supplies needed to operate. News media, newspaper, television, radio, and other media services. Child care services, child care facilities providing services that enable employees exempted in this order to work as permitted. Any manufacturer who retools so that a substantial part of their business is for the purpose of manufacturing and producing ventilators may apply for an essential business exemption under this order. And it will be granted. Grocery stores, supermarkets, warehouse stores, hospitals, and medical facilities are experiencing high levels of demand for a large number of products requiring more delivery. I'm sorry, we're back to the stuff that you already know about. The trucks will be rolling 24/7. You're only going to get 12 rolls of toilet paper at a time. Let me make something clear to the nursing homes that are watching. Your policies are good. You're really stepping up, requiring people to take their temperature before they come in. That is great. That's not a requirement in this order, but it's an extra requirement that you have. But I want you to understand you cannot stop and shall not stop our EMTs who are responding to calls and ask them to take. And this has happened more than once. And everybody's trying hard, everybody's well-meaning. When the EMT gets there, our EMTs need to get to the patient immediately. Whatever your policies are, we need to get to the patient. I think we talked about all these before. I want to open it up to questions. Any questions y'all may have for me or Phil?
I know it's a lot.
Can you just repeat the question?
Yeah, I will repeat the question.
Judge, I know it's a lot in your order, and I know it's a lot to unpack. In layman's terms, in the most basic of situations to anyone watching this, can you kind of, in a basic way, explain if you don't have X, Y, Z job, you should stay at home? And also, how can you guys enforce this? I mean, with allowing people to still go to the drive-thru or the grocery store, I mean, is it kind of a honor code enforcement? But in the basic of terms, can you explain who should stay at home?
Sure. If you're not working for one of these essential businesses, if you're not out taking a walk or a jog in the neighborhood 6 feet away from everybody else, or going to the grocery store or the doctor, you should not be out, okay? And we have a lot going on, folks. We're about to see a wave of first responders as we go out to help people go down and be quarantined. Okay, you've already seen 2 or 3 police, but the more this happens and the more our heroic first responders go out, they go down, and then there's less of them. So I need you to police yourselves. Now, police yourself, and offenders will do it for you. But let us focus on life-saving activities and enforcing, keeping the peace from serious and violent crimes.
We had some drive-through tents that were set up this weekend. Do you have the results of those?
Mm-hmm.
I know first responders, healthcare workers went through those.
I don't know how many we saw today at each place. It was pretty low, actually, at Ellis Davis Fieldhouse in South Dallas. After the first couple of hours, only 11 people. I don't know what it ended up being. I don't know the numbers for either for today, but AAC last night was like all day long, maybe like 120 or so there. People may ask, well, why can't we loosen those restrictions? Well, there's certain federal things at play here too. But as Dr. Fauci said yesterday in President Trump's conference, folks, we are critically low on PPEs. When we give you a swab test and you're asymptomatic and have no fever, it burns a PPE. We're going to get to the place where the healthcare heroes that you need to stay healthy. So when your child goes to the hospital, there's someone there that can take care of your child or yourself or your mom. They got to have the gear. That's why I'm also calling on garment manufacturers, and we've had great outpouring since last night of people who are willing to retool on that and getting us, talking about getting us PPEs. We got our first delivery order today from Bent Distillery for our 55-gallon drums and bottles. They're bottling it for us too. I don't know if it looks like vodka. I haven't seen the bottles, but we are getting bottles from them, small bottles and big bottles that our first responders can use, and that's critical. And for those of you who, just remember, if the first responders go down or the healthcare workers go down, it's like a war, and your army has gone down, and that enemy it will take advantage of that, and more people will get sick and pay the ultimate price. What other questions?
Can you go over again where these projections are from?
The projections. What's the name of the scientists that did the projections?
It's based on some of the Imperial College data, but then there are also some, like it's at covidactnow.org is where the model is by state. You can click on each state. This is specifically for Texas. It shows all the assumptions that are made in actually formulating the model.
Yeah, and I want to make a point to people too. If you remember, in 2012, I made a decision to spray Dallas for the West Nile virus as people began to die from that disease. I did get some information. It really wasn't even as advanced as this, but some information from healthcare professionals. And as I said, these are sophisticated wild guesses based on science. If you want to see what should have been done and when it should have been done, you have to wait for that peer-reviewed article in the New England Journal of Medicine or some other periodical, 2 years from now, and we cannot afford to do that. It is as simple, folks, to the people that say, well, this is an overreaction and we shouldn't have to do this. I've found plenty of business owners that feel that way, and I respect you, and I hate this, but I haven't been able to find a doctor. You can usually find an expert on each side of everything, but at least the doctors that work in the 5 hospital systems in North Texas are pretty clear on what we need to do.
You said you had another death. Is it 3 now in Dallas?
3, 60-year-old. We'll get you more information. Again, I don't, because the fear of COVID, I know we went through this with Ebola, where people had strange feelings about that. I'm talking about people outside of the families who are suffering with the loss of a loved one. So I'm not saying the names of the persons to you. I can tell you there are plenty of us saying the names of those persons, in our prayers, and our prayers are with those families and with everyone who is sick with this disease and suffering with this disease, and also with all the people who are just dealing with incredible hardship and stress and from what's happening here. Let me also say this. We've seen a big spike in child abuse, I guess, when we're home. Stress of being in close quarters can get to some people. I really need people to work on that. I need them to report that. If we're down to our last officer and someone hurts their child, that's where that officer will be going. So this is the worst time for you to hurt a child. And so if you're in that small segment of the audience that struggles with that, just know that you will be extremely sorry if you do that during this time. What else? Yes, ma'am.
Judge, have 2 Dallas County judges tested positive. Have you heard of that?
I have not heard of that. that may or may not be true thus far. Each time that has been said, it hasn't been true, but perhaps it will be. If this continues, if the rest of North Texas does not do what we're doing, I guarantee you that in a group of however many there are, 100 people, yeah, there'll be some that test positive because this is going to be widespread. Red represents, or maybe it's over here, red represents 70% of the population. Now, we're past red because, the governor has followed the lead of Dare County, Travis County, El Paso County, Harris County, and Dallas County, and made this whole state, whatever color that is, I guess orange. But orange is 430,000 deaths. We are the largest metro area in Texas. We have the largest number of cases in Texas. We have the largest amount of community spread in Texas. And we have the largest amount of uninsured people of any metro area in the United States. 250,000 people in Dallas County work for a living but can't afford health insurance and don't have that afforded to them by the state of Texas like they do in California, Oregon, and New York, because Texas didn't take our share of the federal money for Medicaid expansion. So those folks aren't going to the doctor. And if we don't do something, it's going to be very, very, very bad here. If we don't do all that we can do. And when I'm not talking about this order, I'm talking about you now. If you don't do everything that you can do to make smart decisions, if those of you who don't have health care don't find some way, we're going to move heaven and earth to help you to get these tests. When you're sick, you got to qualify for them when you're sick. If you don't take care of yourselves, then and you don't keep social distance, then it's going to get very, very bad here.
So what would you say to people have been tweeting saying, I work in another county, but I live in Dallas County. I know every county is to each his own. Tarrant may be announcing something soon, today, tonight. What would you say to people who live in Dallas County and work in other counties?
Under the extraordinary powers that I have granted to me by the Commissioner's Court, who are my partners in this, I have the power when it's warranted, and I take no pleasure at all in exercising it, to control the ingress and the egress of people. So the order states, and it is legally binding, and is punishable by a fine or punishable by a jail sentence. We certainly don't want to crowd our jails right now with people who are just trying to get to work. I understand this. But the order reads, all individuals currently living within Dallas County, not working, living within Dallas County, are ordered to shelter at their place of residence. What that means is it doesn't matter whether your job is in Fort Worth or whether your job is in downtown Dallas or Plano. If you live here, you're under this order. Okay. Any other questions before we wrap up?
Does this mean all malls are closed, Judge, or still not?
All malls are closed. Unless, well, yeah, I think they'd all be closed. I can't imagine what essential business would be in a mall. But if there is an essential business in a mall, then I suppose one door would be open for that essential business to get in there. But malls are mostly retail, so they'll be closed. I'll tell you an example of what might be in a mall. You might have a restaurant that is doing takeout. Okay, so that would still be open. You might have a UPS store, so that would still be open.
Questions. I was reading through the live stream questions. Some people were asking about physical therapists and chiropractors.
Mm-hmm. So let me find that. That would fall under elective procedures, okay? And I can read that to you again. So, chiropractic would be a challenge. I don't know how you're going to do adjustments on someone and be 6 feet away. Physical therapy, it could happen. I want to make this clear. The gym closing does. So let's take Baylor Institute of Rehabilitation, which is in the Tom Landry Center. That can remain open for rehab. Okay, we want those stroke victims to get better, right? those traumatic brain injuries to get better. The gym at the bottom where people go to lift weights, that's closed. So we're going to figure out some way to have safe distancing. But remember also, if you're in an essential health service, which that is, it's to the extent possible. So certainly if someone is about to fall, then we're not going to be 6 feet away from them.
I know you said essential services. Multiple people are asking, does that mean DART will still be up and running?
DART's going to run. DART's an essential service. We have to be able to get to the grocery store. And DART is one of the, DART, you're seeing DART is considered a first responder at this point, and then for testing protocols. DART is one of the agencies that will be getting an allotment as a first responder of hand sanitizer, because on those buses I want people to have clean hands. Yes, sir.
Part of our audience, they are Spanish speakers and undocumented, and they are sometimes afraid even going to a doctor. They don't have health insurance, most of them. What message do you have for them?
It's I can only imagine how difficult the situation is for you, because you were a part of our community. You were here working. And all of these measures that President Trump and the Congress are talking about will not directly benefit you like they will your neighbor. But here's what I need you to do for this community. And I know you love this community and are a part of this community. I need you to go to the doctor when you're sick, okay? I need you to stay away from the other people in your family if you're sick, okay? I know in Mexico right now, which is one country, there's a lot of misinformation. The health minister is saying the president can't get it because of his moral fiber. That's not the way, obviously, that this works. In this community, we all live right on top of each other. It's so important that we all exercise personal responsibility, go to the doctor when we're sick, or call the doctor when you're sick. As these resources get stretched, we'll be using a lot more telemedicine. Yes, ma'am.
I know you said that it was imperative to realize that this outbreak is larger than Dallas County. And I was wondering if you had a message for any of the other counties watching, or anyone else who is trying to figure out what to do next.
Yeah, I think I gave that message, and that is we have to flatten the curve, and we have to flatten it together. There's 2.7 million people in Dallas County, but there's 7.6 million people in the Metroplex, and there's about 30 million people in the state, and this is going to spread across the state. And a month from now, a week from now, 2 weeks from now, nobody is going to be saying, thank God that I was able to go to work for an extra 2 weeks. They're going to be saying, I wish that my community had have acted sooner. And for the elected officials, what I would say is, I understand how angry people are about their livelihood. I do. I mean, firsthand, all day long and every day. I understand it. But you don't want to be in the situation where you're trying to explain to mothers why their children can't get life-saving treatments, why their grandmother can't get life-saving treatments. So let's all work together, and together we can flatten the curve. And I thank all of you. God bless y'all, North Texas. We can do this. Every one of you, you can do this. You always rise to the challenge. We will get through this together, and please show compassion to one another. God bless y'all.
Important a message from the unit from it's important to have a message. The local, yeah, and the other thing too, trying to maintain zero county.
I really don't want to ride the elevator.
Oh, so for the testing as well, the two sites are open. People that
can still show up and get tested, so.
Even if they don't have insurance.
Yeah, so the two testing sites is free of charge testing, for anybody in the community, so.
It was like a 6-hour ordeal of calling people to get nowhere.
Okay, I'm gonna hang up, or I'm gonna ask that we've got your number. I will take the steps to call, and see if I can't figure out what your next steps will be, and then we'll get back with you.
I appreciate it.
And I want to apologize, because I know with what you said, that it must be very stressful, and let me see if we can't get someone to call you from either our public health area or from our Safety Net Hospital, APS, and we'll see what we can do to help you out.
I appreciate it, sir. And I also ask that, make it a little bit easier for those, that out there that don't have the voice to call and talk in, the elderly, that don't know how to navigate the internet. Please make it, easier for them to get testing as well.
And that's why we've got also on there that nurse hotline. But I understand and hear what you're saying. I will say that I'll get details of who you called. I don't want to get that out there right now. But what I will say is, if the physician felt like you should have been tested, they should have written an order. It should then have been sent to a private lab that would have then, they should have actually drawn the sample. It should have been sent to a private lab for them to run, and then you should have gotten your results back in whatever length of time in that private lab. But I want to call you or get someone to call you right now or in the next day or tomorrow, if not tonight, to help you through that process.
I appreciate it. Thank you.
Thank you very much, and I'm sorry you had to go through this.
Thank you so much.
We have two other calls from people who want to do that. I'm going to try to figure out. Vinny?
So, Your Honor, Dr. Tanasia, we've got him calling in on the same call that the two commissioners are on.
Vinny, are you